This is a typical cervical vertebrae. There are 7 cervical vertebrae. This is just one of the main ones. So this right here is called your spinous process. These 2 prominences are unique to the cervical vertebrae, and they are called biphoid, if I am correct. No, bifid. So, talking through the parts of this is called the vertebral arch. And then this is the vertebral foramen, right through this hole. This side piece right here, right in there, is called a pedicle. This is the body. These are transverse foramen, the side holes. This is called the superior articular facet, and this is the inferior articular facet. This right here that makes up the vertebral arch is called the lamina. Again, this is the cervical vertebrae, and they are known for their small body, which is this part, a large vertebral foramen. As you see in the later ones, it gets smaller. The transverse foramen, or foramina, and the bifid spinous process right here. This is the cervical vertebrae. Now there are 2 special cervical vertebrae, and these are C1 and C2, because they look different than the others. So of C1, this top one right here, this is a superior articular facet right here on both sides. And you have the anterior tubercle, which is this bump right here. And you have the anterior arch, which is just like this whole part right here. And then you have the lateral masses. So these are not called facets on this one. These are called lateral masses right here. And then you have your transverse foramen still. You have transverse process on the ends. You have the posterior arch. And then you also have the posterior tubercle, just like anterior tubercle. This is the posterior. So on C2, you have the spinous process. You have the body. If you can't see it, I'll do it again. You have the body. But then you also have this lovely little notch that comes up through, which is called the dens. The odontoid process of C2. So this is again C1 and C2. C2, you know because of the dens, and then this one just looks super different than the other ones by the large, extra large vertical foramen. So now, moving on. You can also tell cervical number 7 because it has a protuberance the farthest. The spinous process comes out the farthest. So it is known as the vertebra prominens, or just called prominens. Now, moving to the thoracic vertebrae. I'm just going to pick one. This is known as looking like a giraffe. So here we go. Let's dive in. Okay, so this is the body of the thoracic vertebrae. It's medium sized compared to the small one on the cervical. These are superior articular process. These aren't called facets anymore. Now they're the processes. So superior articular processes. You have the vertebral notch, which is this little arch. So it's called a vertebral notch. You have your spinous process, which is here. And then you have your transverse process on both sides. Notice there's no transverse foramen. Then right here, we have a little bump right here and right here that is called the superior demifacet for head of rib. So the head of the ribs are going to come right in here. And then down here is the inferior demifacet for the head of the rib. So we got the superior up top, see a little bump, and then we got the inferior down here. And once again, it looks like a giraffe. And yes, it says that the thoracic vertebrae are medium-sized body, right here, and the body is heart-shaped if you look at it from the top. Do you see how it's kind of like a heart? You have a long, slender spinous and transverse process. It's long and slender. And then you have the costal articular facets, which I actually don't know what those are because that's not labeled in this other picture. So I'm going to have to ask about it. But that is our thoracic vertebrae, and there are 12 of these. So now let's go into the lumbar vertebrae. These ones are known for their very large body, but they have a small vertebral foramen. See, compared to the cervical, these ones have large, and you can see that it's a little bit bigger than the other one. And then they have short, stubby spinous and transverse processes. So they're shorter and they're a little hunkier and stubbier than the long, slender, and thicker transverse processes. This one is known to look like a moose. There we go. It resembles a moose, and this is the lumbar vertebrae. All this one you have to know is the spinous process and the spinous process and transverse process in the body and the foramen. It didn't really go into any of the specific facets or anything on this one, so just know the basics for that. This bad boy is our sacrum. So the sacrum has a natural curve to it. So from the side, this is our sacral promontory, and this is the ala. And then, what you don't see, there's a number of bones that are formed the coccyx. So from this view, up here, this whole region is called the base. And then this is the ala on both sides. And like you can see, like this is the ala. And I like to think it's ala about that base. It's ala about that base. These are our superior articular processes. These are our sacral foramen. This is our median sacral crest. Our coccyx was shown that comes down here. Right above where the coccyx comes is the apex. So I think that's right here, the apex. This is called, from the top, the sacral canal. And then this is the sacral hiatus. Another bone that's mentioned in this section is the hyoid bone. I said that really weird. This is the greater horns of the hyoid bone. This is the body, and these are the lesser horns.